Many people come to my office wanting hormones, and unfortunately, the reason people want hormones is because they have read online, or they have a friend or relative that's taking hormones. And honestly, you do not go to hormones by default because they are lower. I think more important is to take into consideration age. Now that doesn't mean it has to be low because you age, but age and other medical conditions. The appropriate way to do it is to look at every system and personalize your needs, because the ultimate thing will be the best scenario if we can get your body to make its own hormones. And there's no reason why your body cannot, unless it is completely fried. There are many things that affect hormones, anywhere from insulin resistance to too much sex-binding globulin, to stress, cortisol levels, diet, lifestyle, activities, type of food you're eating, all kinds of other things that if you do not take into consideration, you will be over-treating or actually compromising your body's ability to make hormones. When you provide your body hormones, you are telling your body to not make its own hormones in many instances. And I always try to explain patients that let's just fix everything else. Let's look at your hormones and then make a decision based on actual levels once you correct other things, and also age and symptoms. That's the ultimate goal. If we fix other things and the symptoms are still there, then we talk about hormones. But to run and just start injecting testosterone, and then your estradiol or estrogen goes crazy, and then you take an aromatase inhibitor to increase your estrogen, it just really complicates things. I see people come here with multiple things come to me, and it creates more confusion than anything and just complicates things. So if you haven't started hormones, you may want to just get a doctor that will give you that kind of approach, stepwise. And it does take time, and you have to be patient, and you have to monitor, and you have to assure other things are optimized. Another thing is vitamin D. Vitamin D3 is deficient, that can cause problems. Magnesium deficiency, that can cause problems. Lack of sleep. And hormones are going to be something that are going to be, they're going to rotate. They're going to have ups and downs. So you cannot just be fixated in a number, more a trend. Almost true with everything that we do and that we monitor. So my advice is to get a doctor that will be willing to do that. Personalize your own care. Do not follow broad recommendations, because they don't apply to everyone. And do not follow for sure what your friend is doing or your buddy's doing. And if you go to a place that the first thing is like, oh, your testosterone's low, here you go, let's just pump it up, you may feel good for a moment, but I think long term you're gonna regret it. Now, if your goal is to be a bodybuilder at supernormal levels, then this is a different conversation. I'm not the right doctor for that, and there's some guys that are doing that. To me, it's questionable. So anyway, again, get somebody to help you. Don't just go crazy trying to do things overnight. There may be other things you need to fix. Have a good day.